Jill, October is Sudden Cardiac Arrest Awareness Month. It's an important time to really highlight the importance of early detection and some emerging technologies like AI that might help identify heart risks before it's too late. We're going to hear all about it from Dr. Stephen Zweibel, Medical Director of Innovation for Hartford Healthcare Heart and Vascular Institute, also the Director of Device Management Program at Hartford Hospital. Thanks for being with us.
Sure. Thanks for having me, Kara. Appreciate it.
Yeah, Doctor, so how is Hartford Healthcare leveraging AI so that you can really improve early detection that might prevent cardiac death?
Sure. At Hartford Healthcare, we're using AI, artificial intelligence, to look at something that every doctor already uses. This is the 12-lead electrocardiogram, or EKG, but in a completely different way. In partnership with MIT, we've developed an AI model that predicts a patient's heart function, specifically the ejection fraction, or EF, which tells us how well the heart is pumping. And a low ejection fraction is one of the biggest risk factors for a sudden death. So by using AI safely and transparently, we may be able to identify patients who are at risk much earlier, often before even symptoms appear, and we can do it more efficiently and actually at a much lower cost.
Yeah, and tell us about this, because you're actually collaborating with MIT on AI and EKGs. How does that make our care here with Hartford Healthcare even more unique?
Sure. So what's really unique is we kind of blend MIT's cutting-edge data science capabilities with Hartford Healthcare's real-world clinical experience. We're not just building algorithms for the sake of it. We're actually solving real clinical problems. And we're working really closely with them to make sure that our model isn't just accurate, but it's safe, it's explainable, and it can be used responsibly in patient care. And every step of the process, from data handling to testing to implementation, is done transparently with oversight, and patient safety is always front and center for us.
Yeah, does AI really help prevent sudden cardiac death? And I assume you really need the human involvement of the doctors too?
Sure. So, artificial intelligence by itself doesn't prevent sudden death, but it may actually help us find patients early who are at risk before an emergency happens. So we can, with the AI model, detect these subtle changes in the EKG that even an expert such as myself can't see, that are linked to a weakened heart muscle. And then once we identify those risks for the patient, we can actually step in and do some more testing, medications, or maybe even implantable defibrillator devices to help prevent them from dying from sudden death. Right now, we're piloting this at Hartford Healthcare in our medical record system, and so it can alert clinicians safely and only when appropriate.
All right, Doctor, thank you for being with us as we raise awareness during this special month, and very cool advancements. I will let everyone know, for more information, you can go to hartfordhealthcare.org/heart.